Hello, everyone. I'm Margarita Pinton-Perez, the Community Partnership Leader with the Learning Network at the Center for Research and Education on Violence Against Women and Children at Western University. On behalf of the Learning Network, welcome to the Resource Spotlight titled Online Interventions to Prevent Gender-Based Violence, Building Online to Offline Pathways. I'd like to open now with the land acknowledgement. Next slide, please. We acknowledge that we are learning, speaking, and hosting this virtual event on the traditional lands of the Nishnabek, Haudenosaunee, Lenampewak, and Chunnington nations. These lands are connected with the London Township and Sombra Treaties of 1796 and the Dish with One Spoon Covenant Wampum. Today, this land continues to be home to many Indigenous people from across Turtle Island. We give our deep respect to the first inhabitants of this land and recognize that an acknowledgement of Indigenous land and sovereignty comes with the responsibility to understand the history and ongoing impacts of settler colonialism. These impacts continue to be felt in disproportionate and everyday ways against Indigenous communities. We also reflect on those who came to this land involuntarily, particularly those brought to these lands because of the transatlantic slave trade and slavery. As the Learning Network works to mobilize knowledge to address the spectrum of GBV, we also recognize that Indigenous communities continue to experience disproportionate forms of gender-based violence, including the ongoing crisis of missing and murdered Indigenous women and girls and 2S LGBTQI plus peoples. We acknowledge that colonialism continues to shape these realities and that this history and its ongoing impacts must inform our work. We are committed to advancing our efforts in ways that uphold solidarity with Indigenous survivors, communities, and those supporting them. Next slide, please. Welcome to the Learning Network Resource Spotlight, Online Interventions to Prevent Gender-Based Violence, Building Online to Offline Pathways. I'm pleased to welcome our presenters from Yorktown Family Services and Moonshot, who will be sharing about RightPlace, an innovative online service and outreach model that connects individuals affected by gender-based violence with support services across the Greater Toronto Area. I'm going to welcome our presenters to join us on camera. Yay, welcome everyone. I'm delighted to introduce Yorktown Family Services, including David O'Brien, Director of Mental Health, Karen Blake, Manager of Violence Prevention, Glenda Diaz, Program Coordinator for the RightPlace program, Howie Cassie, Care Navigator for the RightPlace program, Halewyn Williams, Family Youth and Child Therapist. And joining Yorktown Family Services is Moonshot's Teresa Raja, Director of Online Prevention, and Nermeen Zia, Program Analyst, leading campaigns dedicated to violence prevention across Canada and internationally. You can find a link in the chat to the page on our website with the presenters' full bios, along with links to Yorktown Family Services and Moonshot. So welcome, Yorktown Family Services and Moonshot teams. I'm now going to hand it over to you to begin the presentation, and I look forward to rejoining you during the Q&A.
Thanks for that introduction. Next slide, please. Next slide, please. Thanks for that introduction. A real pleasure to be here. Once again, my name is David O'Brien from Yorktown Family Services, and thank you to the Learning Network for giving this opportunity to showcase our work for this new program called RightPlace, which is relatively new, really launching in November. But I think today you'll find a couple of things, some of the data and some of the things happening within Ontario primarily and the Greater Toronto Area around gender-based violence is quite striking, but also we're here to also talk about some of the success stories too. So early on, there's been some good findings. Yorktown Family Services is a social, mental health and social health organization. We're an accredited organization based in the city of Toronto, Ontario, Canada, and hello to potentially some international people tuning in today. We are an organization that's been established over 30 years ago. We offer over 30 programs, including violence prevention programs, trauma treatment programs. We have a gender-based violence program and department, including a women's shelter for women escaping domestic violence and intimate partner violence with their children. We have several mental health walk-in clinics, including in downtown Toronto and St. Jamestown. We have a walk-in clinic at Lawrence and Dufferin, or Lawrence and Eglinton, and we also have online services in terms of rapid access for therapy and counseling. We also provide youth outreach services in Toronto's priority neighborhoods. And also, we have a pretty big early years department that engages young children and their families in early years mental health. Next slide, please. I'd like to introduce my colleagues, and I'll start with Karen. Karen, take it away.
Hi, my name is Karen Blake, and I'm the Violence Prevention Manager at Yorktown Family Services. I'd like to introduce my next colleague, Glenda.
Hi, good afternoon. My name is Glenda Diaz. I am the RightPlace Program Coordinator and Spanish-speaking support. Now I'll pass it to Howie.
Hello, everyone. My name is Harry Cassie, and I am the Care Navigator for the RightPlace program. And I'll pass it to Helen.
Hi, everyone. My name is Helen Williams. I'm a family, youth, and child therapist here at Yorktown with a specialization supporting those who have faced family violence. I'll pass it to Teresa from Moonshot.
Thank you. Hi, everyone. My name is Teresa Raja, and I'm the Director of Online Violence Prevention for Moonshot. So I look after our online violence prevention programs globally. I'll pass over to my colleague, Nermeen.
Hi, everyone. I'm Nermeen. I'm an analyst at Moonshot, where I lead campaigns dedicated to online violence prevention across Canada and internationally. I'm really excited to share our campaign findings with you all today.
Next slide.
So we wanted to give a little bit of context as to why we developed RightPlace. So the Toronto Police Service recognizes that intimate partner violence is a serious social problem that has a direct and continued impact on victims and survivors, families, and overall community safety and well-being in Toronto. In 2023, Toronto City Council declared gender-based violence and IPV to be an epidemic. In June of 2023, the Peel Region Council also formally declared gender-based and intimate partner violence an epidemic, a designation that reflects the staggering scale of the crisis in the region. In 2024 alone, the Peel Police responded to over 16,100 incidences of family violence and intimate partner violence, averaging about 44 disputes every day, and that only accounts for what gets reported. Next slide, please. So when we're looking at the scale of the problem within the GTA, we know that 83.5% of IPV occurs in the home and it is hidden from existing services. We have seen an increase of 25.6% in family violence incidences between 2014 and 2024. We know that 95.6% of cases are recent and survivors need immediate support. As previously stated, Toronto City Council declared gender-based violence and intimate partner violence an epidemic. There have been consistent high rates over the last 10 years that demonstrate an unchanging and urgent need, one that existing services alone cannot fully address. Next slide. So we developed RightPlace. It is a first of its kind initiative. We reach the hidden. So we're able to access people coping with gender-based violence in silence who would never walk into an in-person service or access services. We meet them where they are already online. We have digital outreach. We have targeted ad campaigns across Google and Reddit, reaching survivors, bystanders, and those who cause harm. We support navigation to safety. We connect individuals to internal services at Yorktown Family Services or external community partners through a trauma-informed care navigation process. We work and look at the whole family system. We're the only program addressing all three: survivors, bystanders, and those who cause harm within one coordinated model. We have data-driven impact. So we're collecting meaningful outcome data to demonstrate impact, strengthen future funding, and guide continuous improvement. We are filling a gap that is needed. So we know that 83.5% of IPV occurs in homes, not as visible to existing services. RightPlace bridges the critical gap between online and offline support. Next slide.
Okay, thank you, Glenda. So in this slide, I'll be talking about who we serve. So the RightPlace program, it operates through two distinct websites. As you can see, the first one is the Safe Pathway, and the second one is the Steps Forward website. So just to clarify between the two, the Safe Pathway website are for survivors and bystanders, whereas the Step Forward websites are for people who cause harm. So through the Safe Pathway website, we provide service to anyone experiencing fear, control, or harm in any relationship. So this includes the survivors. In most cases, these individuals still live with their partners, and they usually report that they feel isolated, don't have family members. They tell us that they don't have anyone, and they report that they feel scared and need a way out. So we provide the emotional support and connect them with the appropriate service. Also, when it's safe to do so, we follow up with them to check on their well-being, how they're doing, and make sure that they are connected with the services. Also, we provide service to anyone who is worried about the safety or well-being of a loved one who may be experiencing harm in a relationship. So these are the bystanders group. We see neighbors, friends, co-workers, parents who are worried about their sons and daughters being in an abusive relationship reaching out to us, and we provide guidance on how to help, and we connect them with the appropriate services. Also, we provide service to anyone who is unsure if they need support. For instance, I receive inquiries from lots of participants such as, my partner does not hit me, but he constantly yells at me, tells me that I'm worthless, and has access to my device. Is this considered as an abuse? So what we do on our side is that in this case, we provide the psychoeducation about what abuse looks like. And we let them know that if any of these experiences resonates with them, we are here to support them in taking the next step at their own pace and comfort zone. So we give them the freedom to decide and take the next step. So this is about the Safe Pathway website. So coming to the Steps Forward website, which is for people who cause harm, we provide services to anyone concerned about their behavior maybe affecting others, anyone worried about someone else's behavior in a relationship, or anyone who's looking to improve their relationship with loved ones. So I would like to indicate that compared to the Safe Pathway website, currently we have more limited interaction through this website with people causing harm. Okay, so coming to the key program features, both our programs, they are voluntary and anonymous for anyone residing in the GTA. However, I would like to indicate that sometimes participants outside the GTA from Calgary, Ottawa, Cambridge, they reach out to us seeking guidance and help. And even if it's beyond our scope, we try our best to support them. Also, both program ads and websites, they have been translated into Spanish to improve accessibility. It is also designed for individuals who may not be aware or connected to potential services, referrals, or traditional pathways for support. I'd like to add that for many of our participants, they inform us that this is their first time reaching out to someone. They're often nervous over the phone when I speak to them and do not know what support options are available. So we make sure that they are heard, informed what available support options are, and make their decisions. Also, the RightPlace works alongside clients of all genders, all social locations, immigration, and relationship status. For instance, male survivors, they reach out and inquire, are the services only for women? Do you help men? So we explain about our program scope, role, and inclusive practices. So we're committed to providing equitable services to everyone who reaches out. So this is the heart of who we serve and how we serve them. Every interaction is grounded in safety, accessibility, and meeting people wherever they are. Thank you. Next slide will be presented by the Moonshot team.
Thanks so much, Howie. So I've got a fair bit to take you all through today, so I will try and get through it in the best way possible. But bear with us because I think there's some really important information and some really in-depth content that explains how this actual program works. But I'll start with who we are at Moonshot. Next slide, please. So Moonshot is a global organisation working on online violence prevention, and we use digital tools to find people who are finding themselves in harmful spaces online and connect them to support before they reach a crisis point. So as you can see on the slide, we operate across more than 60 countries, operating across 30 languages, and our work spans counter-extremism, gender-based violence, and online harms. So this is predominantly running programs commissioned by governments, platform partners, and NGOs across the Five Eyes countries and beyond. So in Canada, we've specifically been running digital violence prevention programs since 2021. So that's working with federal and provincial funders and with Canadian clinical partners, including Yorktown Family Services. So this work covers everything from extremism and hate-motivated violence through to family violence and suicide prevention. So we've been working with Yorktown since 2021 through the ETA program, and we've been reaching individuals who may be on a path toward hate-motivated or grievance-based violence, and then we've been connecting them with Yorktown's intervention services. And that gave us a proven working relationship and demonstrated that our model, which is to reach people in these spaces online, works in Canada, and this is well before it was ever applied to gender-based violence. So before RightPlace existed, we needed to know whether this model could actually work in a Canadian context. And so I'll quickly take you through the program that came before this one and what it taught us. Next slide, please. So crucially, we have done this before. So between December 2023 to October 2024, across a 10-month period, Moonshot ran digital campaign in the Edmonton metropolitan region of Alberta, covering Strathcona County, Fort Saskatchewan, and St. Albert. It focused on two harm types, so that's family violence and suicide, and it was co-designed with local community partners and 211 Alberta, the provincial online resource line. The total budget for this program was approximately 35,000 Canadian dollars, so it was quite modest by any measure, but that's what makes the results and the impact quite significant. So as you'll see on the slide, there were 51,897 total searches, of which 36,000 and upwards was related to family violence and 15,500 to suicide. So the top family violence search term was women's shelter, searched every single hour for 10 months. These are not curious searches. These are people who have made a decision and are looking for a way out. So they were already looking, and we made sure they found that help at that moment. Nearly 4,000 individuals interacted with ads that we showed as a result of their search, and they visited service provider websites. 287 individuals actually made direct contact with providers by phone, text, email, or live chat, and over 1,400 accessed curated resource links. The search theme data was really striking. So for family violence, 62% of all searches were for shelters or specific guidance. For suicide, nearly 80% were for services like the 988 crisis line, and 11% showed clear signs of active ideation. So this includes phrases like want to end life or can't stop thinking of suicide. And this is the population that we were reaching. It's not people doing research, it's people in crisis. Timing data was very telling as well. So family violence searches peaked between 10 a.m. and 2 p.m. and again between 8 p.m. and 10 p.m. So that evening peak coincides with when partners often return home, when children are in bed, and when household dynamics can shift. Suicide searches peaked at 9 p.m. and stayed elevated until 1 a.m. So this is why 36% of RightPlace contacts in the GTA are happening outside business hours. So it's not a quirk, it's the reality of when people are in these situations, that's when they're able to reach out. Now, demographically, women were 54.8% of traffic where gender could be determined, and the largest age group, 35 to 44. So an adult in an established household relationship, and that profile directly shaped how we designed safe pathways messaging and the targeting for RightPlace, which we'll go into a little bit later. Now, nothing in the GTA campaign is guesswork. So everything we've learned in Alberta, the terms people use, when they search, who's searching, what messaging they respond to, this was fed directly into the design of RightPlace. So that's the foundation of the project, and this is what we built it on. So I'll now take you through what we built together with Yorktown Family Services and how the partnership came together. Next slide, please. So as I mentioned before, we've been partnering with Yorktown since 2021. And so the RightPlace program is the third chapter of this collaboration. And so that's why the history really matters. We didn't have to build this program from scratch. And it meant that we could move fast to build something that's been genuinely integrated from day one. So the Alberta campaign gave us proof that Moonshot's redirect model could work in a Canadian context with Canadian partners and a Canadian funder. So that model is the one where, again, like I said, you're able to reach people who are searching very specific keywords and terms to provide them with the support that they're looking for. RightPlace launched in November 2025, and in just weeks, we had people reaching out. Survivors, bystanders, people questioning their own behaviour. And the pipeline from digital ad to human contact was working exactly as we designed it. And so traditionally, there could be perceptions that this is a tech company that's kind of coming into a very sensitive and critical space. But what Moonshot does and what we really try to prioritize is bringing the digital expertise, but then really relying on and drawing upon Yorktown's decades of frontline experience, because this project could not have been built alone. So I've spoken a little bit about the model, but I'll take you through it in a bit more detail. I'll go through how it actually works from the moment someone types a search into Google to the moment they're speaking with a care navigator. Next slide, please. Online to offline, how it works is the ad, which is the starting point. Someone searches Google with a specific need. So they're not browsing, they actually have a specific need that they're looking for. And our ad appears alongside organic results. So trauma-informed, non-institutional, it's not like a government service, it looks like genuine help and it's neutral. The website, so an individual clicks through to the safe pathway for survivors and bystanders, or steps forward for people causing harm web pages. And these are not generic information pages. They're specifically designed based on focus group input to feel safe, private, and accessible. And there's also the fast exit button. So we use warm language, it's not clinical, and it's in 3 different languages, English, French, and Spanish. Individuals can then actually make contact. So that's through a call, a text, an email, or live chat, whatever feels safest for them. So text is the most common contact method, and 53 people used it in the first weeks alone. People in unsafe situations often cannot make a phone call, and so that choice of that channel is quite deliberate and something that we really draw on and learn from. And then finally, there's the actual relationship and then the referral. So Yorktown's Care Navigator takes over with safety planning, service connection, clinical expertise, and Karen will go into this in more detail. And this is where Moonshot's role ends, at the point of contact, and where Yorktown then picks it up in that step 5 that you can see in the slide. So what we're doing here is we're not necessarily replacing anything. What we're doing is creating a new front door for people who would never find the existing ones. So every person who contacts a care navigator through this pathway is a person who would otherwise have found nothing, or at least not have had access to a service that they needed. So as I transition towards the wrap up of my section, it's really worthwhile understanding who exactly we're talking to and who we're reaching out to. So that brings me to the 3 audiences that RightPlace is designed to reach. Next slide, please. So this program is a first of its kind in that there are 3 audiences that are being reached. Safe Pathway serves survivors and bystanders. So that survivors are anyone experiencing fear, control, or harm in a relationship. And this can include people who are unsure whether what they're experiencing counts as abuse, as Howie said. Bystanders are anyone worried about a loved one. So both groups are served through the same website because they often have overlapping needs. And this is what we do to ensure that we avoid that stigma so that people are able to come to a kind of centralized place for that support. Steps Forward serves people causing harm. So anyone concerned their behavior may be affecting others or who want to improve their relationships. So the name and design are deliberately non-confrontational and non-punitive, which is really critical. The message here that we're trying to impart is that change is possible and support is available. So we're definitely not trying to shame people into better behavior. We're meeting them at a moment of self-reflection and giving them somewhere to go, somewhere meaningful. Now, why the 3 audiences in one program matters is that most GBV digital tools focus exclusively on survivors, and so then bystanders can often become underserved. And the critical bridge to a survivor is that they may not be ready to reach out. Maria's case scenario later in the presentation shows exactly this point that I've just made. So people causing harm are almost entirely unserved digitally. Most programs require in-person attendance, and this can be a significant barrier. RightPlace is reaching this population at a moment of voluntary reflection, which is a really critical point, I think, to underscore, because this is the most promising entry point for behaviour change. So both programs are voluntary, anonymous, and open to anyone in the GTA, regardless of gender, immigration status, or relationship type. And the Spanish translation came directly from focus group findings, as Lily's case scenario will show, it's actually made a real difference, and you'll hear more about that later in today's presentation. So for everyone who's here today, this extends the reach of the work that everyone has already been doing and it's already been established. It's not necessarily adding to workload. RightPlace just finds the people who are not able to find those services themselves in those critical moments of need and crisis. So that's the model, the design, the partnerships, the 3 audiences, and the various steps across that journey for an individual who reaches our website. What I'll do now is hand over to my colleague Nermeen, and she's been leading our campaign work, so she'll be able to walk you through what we're actually seeing, and this is where the real impact is really evident. So thank you, and over to Nermeen.
Thanks so much, Teresa. Next slide, please. So Teresa has just walked us through how RightPlace was designed and how it works. What I want to do now is show you what happened when we switched on our campaigns. Our campaign data figures cover the first 3 months of our live campaigns. So it's from November 25th, 2025 up to February 25th, 2026. So 3 months is still early, and I want to be upfront about that. But what the data is already showing us is pretty significant, and I think you'll find it as striking as we do. So I'll be walking you through what we have seen on Google Search and Reddit and our websites. Next slide, please. So as you'll see on the slide, Google has served over 50,000 offers of support. A Google ad appears when someone types a search into Google, triggering a keyword from our database. So every one of those 50,000 plus impressions landed in front of someone who was already actively looking for help, not just passively scrolling past an ad. About 3,500 of those people then click through to our campaign websites, which I'll talk about in a sec. So on Reddit, we've served over 900,000 ads, offers of support, and received over 4,000 clicks. Compared to Google, Reddit works quite differently. So it's a platform of community forums with topics like parenting, relationships, and mental health. Our ads appear within those conversations, reaching people who may not be actively searching for support, but they might be in the right headspace. That's why the impression volume is much higher. And those 4,000 clicks represent real, meaningful engagement behind the numbers. So our campaign websites have had over 5,500 active users and 382 returning users. The returning users matter as they represent users with a high degree of intent and engagement. These aren't accidental clicks. Someone who comes back a second or a third time is genuinely engaging with the content. We also see that 114 people went further and accessed the resource links on the website. So to put all of this into perspective, our entire 10-month Alberta campaign recorded around 51,000 total searches. RightPlace has already served over 1 million impressions across both platforms in just 3 months. So we're operating at a fundamentally different scale here. Next slide, please. So this slide is showing us two different things. And I just want to be clear because the numbers might be a little bit confusing here. On the left, you have the demographic profile of everyone who visited the RightPlace websites. That is drawn from our campaign analytics. On the right-hand side, you have the contact methods that were used to reach out to Yorktown's care navigators. So those represent a smaller, more specific group of people who went further and actually reached out to a human being. So these are not the same population. The numbers are at different scales, and let me talk you through both.
Me, Margarita here. If we could just go a little bit slower for this, awesome.
So over 2,000 female and over 500 male users visited the campaign websites over the past 3 months. Unsurprisingly, website visitors skew heavily female, though we have designed RightPlace to be open to all genders because that reflects the full reality of GBV. On our Survivor campaign specifically, 83.5% of known clicks came from women and 17.9% from men. The age group with the most clicks was people aged 35 to 44, which accounted for about 23%. And that was consistent with what we saw in Alberta. Of the people that went further and made direct contact with a care navigator, text was the most common method of outreach, followed by email, then phone, and then live chat. 36 participants used more than one contact method, which tells us that these weren't one-off moments, but sustained engagements. And that 36 represents people who both either began with one contact method and then transitioned to another. So for example, people who started off with the live chat and then maybe moved over to texting or phone when they felt more comfortable. It also represents people that reached out multiple times. So some people might have reached out on text and also sent an email to follow up. So the most important finding that we found was that for the majority of participants, this was the first time that they had ever reached out to a support service. These were not people who were already connected elsewhere and had also found us. These were people for whom this was the first point of contact. So we know that RightPlace and our campaigns are reaching people for whom existing services were not reaching. Next slide, please. So one of the things that digital campaigns allows us to do that traditional services simply cannot is understand exactly when and how people look for help. So it's not just that we know that they're looking, but we can also look at the hour of the day and the day of the week when they're conducting searches. So this slide shows 2 things. The bar chart on the left is when our ads were being searched for and served. And then the figure on the right is when people actually made contact with Yorktown's care navigator. So just keep both of those 2 things in mind. So what we see in terms of impressions by day. So Wednesday is the highest day, followed by Tuesday and Thursday, and then Monday with the weekends kind of petering off a little bit. Generally, a trend that we've seen across campaigns is that searches tend to peak midweek, and they tend to be lower on the weekend. This is worth noting because it suggests that people are searching around the rhythms of daily household life, perhaps when a partner is at work or children are at school. The dot chart below shows peaks by hour of day. So what we can see here is that searches peak in the mid-morning and then again in the evening. So this actually matches our Alberta findings as well. We found that family violence tends to peak between 10 a.m. and 2 p.m., and then again around 8 to 10 in the evening. The evening peak is particularly significant. It often coincides with when a partner returns home, potentially when household dynamics shift. We also found that 36% of participants attempted to contact a care navigator outside of their regular business hours. This underscores the critical role of digital access to complement in-person services. The aim is not to replace in-person services, it's just to extend them into hours that can't be covered. And just to note that there's on the websites, there's multiple ways that people can reach out, as mentioned earlier. So live chat, which is live from those certain hours, but there's also texting numbers, emails, etc. And then there's also resources available for people who don't feel ready to reach out, but just want to access a particular resource. Next slide, please. So what you're looking at here are the keywords that real people in the GTA have typed into Google. So it's not what we think they're looking for, but this is the data based off of what is actually being searched. There are 3 columns here, survivors on the left, bystanders in the middle, and then people causing harm on the right. So I want to give particular care to that 3rd column. So these are people in a moment of private questioning, not confirmed perpetrators. So survivor searches include generally women's safe houses, women's helplines, women's help centers, resources for restraining orders, emergency shelters, and questioning the kinds of abuse that they might be experiencing. What we found is that these are practical, immediate searches, often looking for shelter, legal protection, and safety. They're not information gathering. These people are looking for a specific service or resource. Bystander searches include how to recognize abuse in a relationship, what is controlling behavior, signs of emotional abuse, and how to help a victim of domestic violence. So what we found with these searchers is that they're often motivated and action-oriented. The data backs that up. Between 9 and 15% of bystander ads served were clicked on. That is a very high engagement rate. For people causing harm, we found that people were often searching for what is a healthy relationship and how to control anger. So these are people in a moment of private self-reflection, sometimes questioning their own behavior. That is a promising moment for change before they've had to commit to anything or identify themselves to anyone. Next slide, please. I also want to talk about the demand gap. So everything I've shown you so far is what RightPlace has achieved. This slide is about what the data tells us of the demand that exists beyond what we are currently reaching. There's a figure on this slide, 42.61%, that I want to explain before you see it, because without context, it will not mean much. This is our search impression share. So what that means is, if you think back to the searches that we just went through, for example, a survivor looking for for a safe house, a bystander searching for signs of controlling behavior, etc. Every single one of those searches is happening within a pool of thousands of searches happening across the GTA at any time. So Google tracks the proportion that our pool of ads appeared in. That's our impression share. So for what this means is that a share of 42.61% means that our ads appeared in under half of those relevant searches during that time period, meaning that there's another 57.39% of similar searches where someone was looking for help and they did not see our ad. The reason for that, RightPlace is working really well. Thousands of people have been reached who would have otherwise found nothing. But the data also shows, honestly, that the need in the GTA is greater than we are currently meeting. This is not a failing of the program. It's simply a reflection of the scale of the problem. The demand is there, it is consistent, and with continued support, we can answer more of it. So for the practitioners in the room, you already know from experience that the people who reach your services are not representative of the whole population that need help. This is the first time that we can kind of begin to quantify that gap digitally, and it gives us something concrete to work towards. Next slide, please. I want to end my section by coming back to something that sits underneath all of those numbers. None of what you have just seen was designed in isolation. Before we wrote a single ad, built a single page of the website, we went and asked. We ran 7 focus groups with survivors, bystanders, practitioners, and community members. We worked with experts, including this network. The GBVLN was involved in helping us design, get the program designed right from the start. And what those conversations told us shaped every single decision that we made. So what we found, some of our key findings were safety and privacy are non-negotiable. Every single design choice, so for example, fast exit button, so someone can instantly switch to a different page, plain non-clinical language in our ads, no requirement to give your name at any point in accessing a service. All of these came directly from community feedback. This is why people actually use the service. We also found that language can be a barrier, not just a preference. So focus group participants were very direct about this point. If the website is in English and you are a Spanish-speaking survivor, the service may as well not exist for you. This drove the full Spanish language campaign and website. And Lily's story, which Yorktown will share shortly, shows exactly why this decision mattered. We also found that live human support is what converts a website visit into a helped person. So a website full of information is not enough. People need to reach a real person who listens without judgment and knows what to do next. The digital campaign brings people to the door. Yorktown opens it. Finally, different audiences need different platforms. So Google searches are for people who are actively searching. Reddit reaches people in community conversations who may not yet know they need help. Using both means that we're able to reach people at different stages of readiness, and the data shows us that they behave differently on each. This is what the digital side of RightPlace looks like. The searches, the timing, the keywords, all of it points to the same thing. People are looking for help. What happens when they find it is where Yorktown takes over. So I'm going to pass it back to Yorktown to walk you through some of their findings.
Thanks, Teresa and Namin, for providing that context for Moonshot and that data analysis that really shows the importance and the success in cross-sectoral collaboration. Next slide, please. So Teresa walked us through a little earlier about the flow of client interaction and went to speak a bit more about that referral pathway once folks do connect with us. So as Teresa mentioned earlier, folks get connected to us by clicking on an ad, either to Safe Pathways or Steps Forward based on the keywords that they have been searching. They're then redirected to the relevant website, and there they have a few options, which is really embedded, in that trauma-informed principle of choice. They can engage with resources on the websites in some sort of self-guided exploration, or they do have the option to connect with a care navigator, a human person. They can connect with this care navigator by phone, by text, by email, or live chat. Once folks reach out to the care navigator works hard to build that initial rapport and to build trust. As we've mentioned earlier, for most folks who are reaching out, this initial contact is the first time that they've ever reached out to somebody, a service provider, for any kind of support. Through that initial contact with the care navigator, where a collaborative needs assessment is conducted, kind of get a sense as to what the client is looking for. And if it's appropriate, we'll go ahead and do an intake. From there, we can provide internal or external referrals. And we are uniquely positioned here at Yorktown to offer many different internal referral supports based on existing and very well-established programs that we have. One of those programs is our transitional support services. so we can connect women with an individual counselor for ongoing therapeutic support for up to a year. This service is for women who have experienced gender-based violence. And we also have a group called Here to Help. That's a group for mothers and their children who have experienced family violence. Here to Help is a therapeutic group used to give space for mothers and their children to explore their thoughts and explore their experiences surrounding family violence. We also have a group for fathers who have used violence in their families called Mindful Fathering. It's a mindful-based workshop helping fathers to understand, was to start to understand the roots of the reasons that they used violence and to start learning different parenting strategies. And as David mentioned very early on in our presentation, we have a very robust mental health programming here at Yorktown. We have our What's Up Walking Clinic, which provides brief single session therapy for anyone under the age of 29 and caregivers. And we are very soon launching a walk-in model specifically for RightPlace, which will directly support clients who are calling in who need immediate crisis intervention. Our Care Navigator has a significant resource library externally as well, where we can redirect folks to safety planning, legal support, housing, financial support, and psychoeducation. And again, RightPlace is set for connecting those who may not have access or may not know how to get access to support typically. If you are a service provider and you are looking to make referrals, you can connect directly to us at Yorktown. But this is for folks who may have no idea where to turn or where to start, and really position ourselves to be able to support those folks. I will pass it back to Howie and Glenda, who will provide a bit of some case scenarios to show how this flow works in real time. Next slide, please.
Thank you so much. Okay, so I'll be sharing one case scenario of a bystander known as Maria. So we received many cases like Maria through our program, and I'd like to share one that became a real success story for our team. For confidentiality purposes, the name and some details of the scenario have been changed. So just to provide a general context, Maria says, "I didn't know where to turn. I just knew I had to do something." Maria concerned sister saw a RightPlace ad asking, "Do you know someone in an abusive relationship?" She found the Safe Pathway website and called the Care Navigator. Her first concern was whether the program was connected to immigration services. Her sister Sophia was in an abusive relationship with 3 young children. Maria felt helpless and afraid that involving anyone might make things worse. She wanted to help her sister escape the abuse and keep the children safe. So I remember when Maria called me, she was very hesitant when she first reached out. Once support and trust was built, I took the time to do that. She felt reassured and she started opening up about her sister. So as a program, we had to consider several presenting issues. First, the intimate partner violence her sister was experiencing. Bystander Maria, she was unsure how to help. She feared that also involving someone might make things worse for her sister. And also her sister was also part of a newcomer family with a very limited support network. So what we did on my side was we took the time to interact with Maria on separate occasions, guiding her on the next steps and helping connect her sister with crisis line numbers, including the Assaulted Women's Helpline, emergency shelters across Peel, Durham, Toronto, Halton, York, as availability can be limited, as you are aware. A general safety plan, RISA, and external referral to Barbers Life Recovery Clinic. So the outcome about this case was within a few days, Maria called us back to let us know her sister had left the abusive relationship with her children and was safely residing in a shelter. So She expressed a very deep gratitude for the support she received from the RightPlace program. And this case was really incredibly encouraging for our entire team. So this is just one example of the kind of impact that RightPlace can have, especially for newcomer families and bystanders who don't know where to turn. It also shows the important role of bystanders in preventing gender-based violence. I hope you found the case interesting, and thank you. Next slide will be presented by Glenda.
Thanks, Howie. So this is a case scenario of survivor. So some of the presenting issues that Lily came to RightPlace for were in having experienced intimate partner violence, wanting support in her first language, which is Spanish. She did have some fear of entering the shelter system. She had housing concerns and a limited support network. So she saw the Spanish ads that led her to the RightPlace Spanish website. And although she's lived in Canada for several years, she wanted to share her experience in her first language. She was in a precarious living situation, was attending post-secondary, doesn't have any extended family in Canada beyond her abuser's network. And she had heard difficult stories about shelters and was afraid to enter the shelter system. So we were able to walk her through what that would look like for her. She was connected with the Assaulted Women's Hotline and Barbara Schleifer to get her some legal support to start her separation. She did find a shelter spot at a VAW shelter. And the feedback that we did, because we did a follow-up with her, is that she was grateful that we were able to take the time to speak with her in Spanish. So again, we've highlighted that the language is important. Although somebody has been in the country, sometimes their first language is what they feel more comfortable in. Next slide. I believe this is Karen.
Oh, sorry there. Hi. Who does RightPlace reach? We have the data that we're showing here is from November 24th to December 31st. It's only our first 5 weeks of program. We reached out to 94 total of individuals. We also had 77 participants have meaningful engagement, which includes resources, safety plan, and follow-up. 80 survivors of abuse and 8 bystanders. If you look at this, we showed emotional support provided was 38 participants, and resource navigation was 32 participants. Safety planning, 18 participants. Referrals to counseling services was 20 plus participants. Legal support referrals were 7 participants, and language support was 2 Spanish and 3 Urdu. And if we look at this, since December 31st, the number of individuals reached out has more than doubled, demonstrating a rapid growth in awareness and demand. Our data shows immediate demand for our service. High engagement rates. Most people didn't just contact our service, they engaged in meaningful support. Currently, the majority of users are survivors of abuse. Our support is beyond information. It's emotional support, resource navigation, safety planning, counseling and referrals, and legal resources. 36% of our contacts occurred outside business hours, demonstrating the importance of a 24/7 digital access for individuals seeking support. Most contacts occurred through text, email, highlighting the importance of discrete digital pathways to support. Next.
So we know that we are reaching the hardest to reach audience, which is people causing harm. So what we know so far is that the website for Traffic for Steps Forward is present. People are finding the site. The direct care navigation contact from this population has been limited, though we have connected with a small number of fathers and have provided external referrals. We know this is consistent with what we know from the literature. This population is the most hesitant to self-identify and seek help. Some of the things that we're doing to increase the traffic on this website is refining ad copy and messaging. We're expanding the keyword strategy to reach people earlier in their search journey. We are exploring YouTube as an additional platform for this audience, and we are applying learnings from our existing perpetrator-focused campaigns in other contexts. We continue to analyze website behavior data to understand drop-off points. Next slide.
What has RightPlace taught us? Here are our key learnings. A digital access reaches the unreachable. The majority of participants said that this was their first time reaching out to a service. Being anonymous removes a critical barrier to service. Language is a gateway, not a preference. The Spanish campaign and website directly enables Lily's story. Language access isn't optional. It's foundational to equitable services. Demand exceeds capacity. Search volume data shows more people are looking for help than we are currently reaching, making the case for sustained and expanded funding. Out of hours, demand is real. 36% of our contact attempts occur outside business hours. Digital pathways extend the reach of in-person services into times that they cannot cover. This tells us the importance of 24/7 digital services. Bystanders are underutilized at the entry point. Bystanders like Maria are motivated, reachable, and can be the critical bridge to survivors who are not yet ready to reach out themselves. This is a whole family model is needed. Safety planning, children's mental health, accountability, programming. No single service can meet a full spectrum of needs. Coordination is essential. Digital pathways are expanding access, revealing unmet demand, and highlighting the need for multilingual, whole family, and around-the-clock support systems. Next. Where are we going to go from here? Next steps? Moonshot?
Thanks, Karen. So where are we going from here? So what our plans are to continue to expand our campaigns. Some of these Glenda mentioned earlier. One of the things that we're focusing on right now is expanding to YouTube to try and more effectively reach people causing harm earlier in their search journey. We're also planning to broaden our keyword strategy to capture more of the documented search volume. Our plan is to continue optimizing multilingual campaigns, particularly Spanish, and reach the people looking for service in different languages more effectively.
And for Yorktown, our service development is to grow care navigation capacity to meet increasing demands, partnership with Barbara Slifer, a commemorative clinic, and strengthen connections with housing, legal, and culturally specific agencies to provide ongoing consultation with U of T, Thrive Lab for research and evaluation, and multi-sector collaboration across housing, health, justice, and education. Our vision is shared. The model has demonstrated impact and the need is evident. The opportunity now is to scale the approach to reach more communities and strengthen our early interventions. Thank you so much for attending our presentation. We have saved, next slide, please. Thank you. Thank you so much again for attending our presentation. We're going to save 30 minutes for questions, and we also have some resources and references at the end of our presentation. Please reach out to Moonshot or myself, Dave and myself. If you have further questions, we'd love to answer them. And now for questions.
Wonderful. Thank you so much for the presentation, and I welcome everyone to join us on camera, all the presenters. I really appreciate the way you walked us through both the model and early learning, from the program. And what really sticks out to me is you're highlighting something that's so important in the GBV sector, is that there are many people who may be experiencing harm or who are concerned about someone they care about, or who may be causing harm, who never walk through the doors of service, right? They are never walking through those doors, but they are actively looking for support. So I think, what's so valuable is seeing that your data, what you're talking about here with your data and speaking to the program, is you're also helping us see like how you're making help seeking visible, this type of help seeking that's happening online. So it also really raises some really important points also, and demonstrates digital pathways and how they can complement the work that's happening here in through community-based services. So thank you so much for the presentation. I want to move us into the Q&A period. So an opportunity for us to respond to some audience member questions. And I continue to welcome you to submit your questions in the Q&A if there are some. I'm going to start here with, digital access is such a powerful point of entry, and we heard that so much in your presentation. And it also raises questions about safety. And so one of the questions from a participant was, how do you ensure that targeted ads are not putting victims, survivors at risk of further harm? For example, if they are seen by an abusive partner that they are still living with. So I welcome any member from the presenting team to respond first.
I can jump in, and then if anybody wants to add to it, like please feel free. So there's a couple of things. So on our side, there's a few safeguards that we can put in place. One of those is that we never retarget people. So the ad would only appear at the exact moment of their search. They would never see an ad again otherwise. And our database also really aims to reach people that have high intent searches. So we know that they're looking for support, and then our job is to provide that support. What we do provide is we have, if they click through the ad and they go to the website, there's a ton of resources. Most notably, there's the quick exit button. So we've tried to make sure that people are able to very quickly leave the website if they need to, that we know that presents a high risk. And in terms of like the search itself, it is presenting a risk, like the fact that they're making that search. The ad at least presents an opportunity for them to get help as well. And our ad language also, we developed very closely with Yorktown, so that tries to follow do no harm principles as well, to make sure that the ad itself is sensitive. So we're doing everything that we can on our side to provide those safeguards. But yeah, if anyone else wants to jump in.
I can also share that we're very careful. If we always ask participants who interact with us, we never reach out to them, they reach out to us, and that's key. We want to make sure, and if there is someone who's abusive in the home, we do a code. So, and we also use the RISA safety plan, which is excellent, and we've all been trained in that. Anything else that anyone would like to add?
Yeah, also I'd like to add is when sharing resources, we always ask our participants if their device is accessed by their partners, or when is the time, like safe time to send all the resources. Sometimes participants give us the consent to have an alternative email address, so the resources would go to the right person. So we are trying our best to keep everyone safe.
Thank you very much. Thanks so much for that response. During the presentation, there was a mention, I believe it may have been Nermeen when you were presenting about all relationship types. So when presenting data on the demographic and geographic profile of who is reaching out. So there was a question, does this include adult children who harm?
Yeah, I would have to look at we don't have, I think, like a big percentage of that in our data set, but the data that we presented does just include everything that we cover in our database. So yes.
Thank you, Nermeen. There was a question in the audience. Do you have supports in place for survivors of sex trafficking or exploitation and their family members, such as connections to safe housing, therapy, counseling, or other referral services?
May I respond? Yes. So our program has a very big resource bank list, not just related with gender-based violence, but also additional support services, including housing, autism support services, name it. And we try to arrange it in like every area. For instance, I just type Burlington and the resources pops out. And as the needs of our participants also like we're learning on daily basis, we're trying to expand our resources. So yes, we are like we have a compiled source bank list.
And we are welcomed. We can share that resource bank that Howie has created and developed. She's put a lot of work and energy into it, and it's fabulous, I have to say.
Thank you, Karen.
Wonderful. Yeah, that would be great to include and to share. So I know that your Yorktown Family Services has experience working with youth. There's a question here specifically. Do you have experience working with youth, specifically K to 12 age range? Or are your programs better suited for adults? So I'm thinking here, this may be related to what we're talking about with RightPlace.
I can answer that. So I think it depends on the need that the family is coming. So here to help is specifically for moms and children who between 4 and 18 that have left abusive relationships. We also have our child and family therapist that is attached to us as well that can support younger children and parents with parenting resources as well.
If I could just add on our side, so from an ads perspective, we do serve ads we don't have any gender-based targeting, so we serve ads to all ages. But Google does protect the data of anyone under 18, so we don't have a lot of insight into who those people are. It's for their safety and protection. So it is possible for younger people to reach the website and then reach out.
Thank you so much.
Oh, I just wanted to, go ahead.
Go ahead,
I wanted
Karen.
to add, regarding our services for youth, we have many services like our youth outreach program, Connect 4. We do quite a bit of work, WhatsApp walk-in. We have that. We have many services in particular just catered to youth, our wraparound support that we have. So please contact us if you would like more information and resources on youth. We do have quite a few programs that we do deliver.
Thank you, Karen. So this is an opportunity to clarify the process. There was an audience member that was asking for clarification regarding how Moonshot and Yorktown Services collaborate on the entry point to the programs. They asked if it is primarily through self-referral.
So it is self-referral, so it isn't a program that someone can refer to. The websites can be provided to somebody if you feel that they could benefit from the resources available. On the websites, we have a variety of resources. It isn't just communicating with our care navigator, and they can, while they are on the website, connect with the care navigator. It is more if you feel someone could benefit, you can provide them the website. So we don't necessarily take referrals, but Yorktown does offer a variety of programs. So if there is a program specific, Here to Help or Mindful Fathering, that you feel might benefit somebody that you work with, you can reach out to Karen or Dave.
Great. There was also a question around what types of supports and services someone who is causing harm of any gender might expect to receive. So thinking aside from the group for fathers, they were curious, what kinds of services would someone who's causing harm of any gender expect to receive?
I can answer that. We have, of course, Mindful Fathering. We have the group program, which is for fathers who have been abusive to their current or ex-partner and have children that have witnessed. We also have our walk-in clinic and our rapid virtual counseling services. So many of our fathers, even before group, might utilize our walk-in or our rapid virtual counseling. Also after group, we know it's really important. If you've had these patterns of causing harm, that a group isn't going to be one time fix all, and so it's really important that we have a therapist like Halwyn, connected to the fathers. So again, it's a pathway of services. So there's always a therapist after group that the father can connect to, and a therapist before group as well.
Yeah, I'd also like to add, for instance, if people causing harm reach out to us, there are support services, for instance, external referral like Man Up Against Violence Helpline. It's focused on preventing violence against women. Services, crisis support, safety planning, referral for men. We also have a male engagement program. It was, I think, developed by CAS. So we do have several resources, and we are ready to make that connection.
Thank you so much. I have a question that is about, navigating some of these, some offline barriers. So, for example, they're sharing here, like if a shelter was full, for example, what safety, if was safety planning the only option, and just an acknowledgement that it also can be so difficult when you're possibly only interacting with a person once.
Sorry, can you go over the question again, please?
Sure, sure. So, how did you navigate offline barriers, such as shelters being full? Was safety planning the only option? It can be so difficult when you're possibly only interacting with a person once.
Okay, shall I answer? Yeah, so first, when participants reach out to us, most of the time they're in crisis, right? So first thing that we do is we provide the emotional support. And I have done several referrals, internal referrals to our transitional support worker who provides the ongoing guidance and counseling services. So let's say if a mom wants to escape today, we can also just give her alternative resources such as not just safety plan, but also connection with an ongoing counselor, counseling services. So at least she would be ready. And we also guide her in the next steps of calling shelters. We are very transparent and we tell our participants that please do not give up, call every day. We also provide the Assaulted Women's Helpline number because after business hours, let's say if things escalate in the household, we give them the tool to at least access crisis line numbers. So even if we're not 24-hour service, we give them the connection to get service after.
We also recognize as a program that it is hard to connect participants with services. There are long wait lists. We know that shelters are full. Howie does a great job of also providing just in the GTA, providing not just in Toronto, but here are some central intake numbers outside of Toronto, specifically Halton region. She has all of those. So being able to, if they need find somewhere else outside of the GTA or outside of Toronto specifically.
Thank you both. Thank you. This one is a question related to the data. How do you determine which search terms are being searched by bystanders, victims, or those who cause harm, besides the most obvious ones? Isn't there some overlap in search terms among these groups? For example, a search for what is emotional abuse could possibly fall under all three categories.
Yeah, I can take that one. And that's a great question. I think that a couple of things to note. So absolutely, there are certain keywords that we have in our databases that could apply to any of the three audiences that we serve. So we have keywords that appear in different databases, like the same keyword essentially in all three. What we also do, and it's very difficult to ascribe intent to a search. So we don't know just purely from the search. If someone types those exact words into Google, we don't know who they are. And so what we've done is that we've kind of tried to create a link between the two websites. So for example, on Steps Forward, so let's assume that somebody searches for something, they see an ad for people causing harm and they land on the Steps Forward website, but they might be, for example, a bystander. There's a link that says like, do you want to get help for somebody else? And then it takes them to Safe Pathway. So people can obviously understand when they end up on the website that maybe the program that's outlined there is not for them. And it just goes back to like, this is a self-referral project, it's a self-referral program, but we want to make it easy for people to find the thing that best fits what they're looking for. And then on the analysis side, we're still pretty early in the project as well, but that's something that we're trying to figure out is how best we can delineate between those different groups. And so what we do is that we look at not just the keywords, which is our database, but we look at the search terms as well. Sometimes people will search something that's close, but it might provide us with a little bit of extra detail about what they're actually looking for and who they might be. So always with caution because we don't want to over kind of assume who they are. So what we really try to do is just provide supports all the way through so they can kind of find where they need to go. And then also from the analysis side, we try to look at website behavior and try to understand. So we can also look at, for example, our particular keywords that maybe appear in both databases converting, significantly better on one website. That kind of leads us to believe that it's maybe more so bystanders who are using that keyword to search, or is it people causing harm? So it's an ongoing process. But yeah, we do the best that we can.
Oh, I'm muted. Thank you, Nermeen, for the response. So there is a question here, again, related to data, but also brings together the Yorktown team as well. What happens after the needs assessment and safety plan services that Yorktown provides? Is the data collected? For example, do you have a way of tracking or knowing what percent of people end up actually connecting with these services?
So we do keep data on the people that we've interacted with. It's hard sometimes because we can't always follow up. So we do document what referrals we've provided or how we has provided to them. And then unless we have contact, like the two stories that we gave, we were able to do follow up because it was safe. We can't always follow up if it's not a safe place because we do have a lot of participants that are still in the relationship. So when it's safe to do so, we're able to do follow up and we're able to kind of document that and have that information, but we can't always.
Thank you. So there was also a question here in the example where a bystander raised concerns about children being involved. It brought to mind for someone concerns about the emotional well-being of children and potentially child protection considerations. So this audience member is wondering how these types of concerns are navigated through the program.
Hey, first, when we reach out to the participants, we are always transparent and discuss about the confidentiality protocol. So we had incidents that we had the duty to report to CAS. So if a mom mentions that a child is hurt or is not in a safe place, then we are transparent and we go ahead and report. However, if they just there's first no right and wrong answer is how you see it as a practitioner. So when we engage with them, for now, I always ask a safety question asking them that are the children safe? Is anyone hurt in the household? These are always our safety questions that comes during the beginning of our engagement. And if they report that for now my children are safe, but I'm worried about their safety, so we make sure that we connect them with the appropriate services before things escalate. But at that moment, if someone is hurt, then especially if it's children, then we make sure that it is reported to CAS, and we had done it maybe twice or 3 times.
As well, I wanted to add our websites do have the confidentiality clause, and both websites indicate our duty to report, and that is laid out in the website as well.
Thank you so much. And those are great questions as well. And I'm glad you were able to provide more clarity on that. Just looking at some of the other questions that we received as well, there was a question around if you could share a little bit more about regarding culturally specific services and any next steps or identified by Yorktown Family Services through the program.
So I think it depends on the need. And so right now, what we have been able to do is translate. We're working on getting everything translated to French. So right now we have it in English and in Spanish. We are working on getting the French going. But if there is a person that is looking for specific culture, Howie, again, in her amazing database, has a lot of agencies that can meet the needs of culturally specific needs. So it really just depends. So we don't for sure have a definite yes or no. It just depends on the needs, but we try our best to connect people with the appropriate services.
Yeah, just to add, so the needs of our participants is not the same. So let's say if a participant who needs Punjabi, Hindi, or Urdu support. So for instance, so far we did referral 1 or 2 to Indus Community Service, Mississauga and Brampton, South Asian Women's Center, Rexdale Women's Center. So we try to like if we don't have the services, then we try to do an external referral ethnocentric program that could align with our participants' needs.
Wonderful. And thank you, Howie. Yeah, there were questions about, other, interest if it was going to be expanded into other languages beyond Spanish. And it's exciting to hear that you are also moving forward with French. So within the questions, I see something exciting as well about some folks that have shared, we have a 24-hour GBV text-based chat line, and interested, for example, in becoming a partner, reaching out to Moonshot and Yorktown. And then there is a question also about RightPlace. Is RightPlace a collaboration based on funding that will end, or will it become a more permanent program?
I can answer that. We have a year and a half of funding. So it's not ongoing. And so we really do need to collaborate, make partnerships. We'd like to have 5 of Howie's, we'd love to have 2 of Glenda and Halewin. So we are really hoping that we will get ongoing funding. At this particular time, we have a year and a half left. So, being presenting today is such an opportunity because we really do want to expand and we want to connect others to support this program. And so we can support your services as well.
Thank you, Karen. Can I ask a question about thinking about this in terms of scale? And I saw that final slide where there was an emphasis about scaling. What do you believe would be required to scale the model, for example, nationally, or across different communities? And just wondering, in your thinking around that, what would you say is required to scale it nationally or across other communities?
I can start and others can jump in. Definitely more funding, more Howies, more Glendas, more Halewin. It's something we'd like to have more languages. This is a very unique program. I think, in all my years in the violence against women sector, we're reaching people that would never come to a service they wouldn't come in person. And we're reaching such a wide, broad range of people that need help. And so we would love to see this expand, but of course we need additional funding to do that. And we have a great partnership with Moonshot that can give us the data. So, together, I think we make a great pair. And, we have lots of great programs, but often we don't have data. And we actually have data with this program, which is very exciting. And we're also showing the need. There's such a great need, not just in Toronto. So we would love to expand this program to other places.
Yeah, thank you, Karen. And I'll quickly jump in there on our behalf. Yeah, it's definitely ultimately about funding, because that really is the key to increasing reach. So, as we've kind of taken you through the methodology, being able to create greater reach using the ad campaigns is really key to how this entire program works. And so being able to expand to other platforms. So really with online violence and prevention, as a methodology, it's about reaching spaces where people are and where they're in need. So it's really about then being able to select the right platforms and getting the accuracy around reach. And then, of course, expanding to other languages as well. And I think everyone's covered that in different ways today in responses to questions. But it's a really important question because it can be scaled and it can be expanded. It's just getting the resourcing right and then being very intentional about how we do come up with a strategy for reaching the most people who are most in need.
Wonderful. Thank you all. That's the time that we have for our Q&A. So thank you. I want to just, while you're all on the screen, I just want to say thank you so much. I agree, Karen. This is such a wonderful partnership you both have, Yorktown Family Services and Moonshot. Thank you so much for taking the time to be with us today and to share all of this wonderful information with the Learning Network audience. I also just want to say a special thank you to the rest of the Learning Network team behind the scenes. We have Mara, we have Jenna and Laura, and thank you as well to our ASL interpreters, Tracy and Kevin. Thank you.
Thank you. Thank you for this wonderful opportunity. Have a great day, everyone.
Thank you. And just a friendly reminder before we wrap up, a friendly reminder that there will be an evaluation, a feedback form that pops up at the end when this Zoom webinar closes. And if you'd like to also receive a certificate of participation, you can follow along with the link as well. So on behalf of the Learning Network, we do look forward to welcoming you at our next event. I'm just going to share two reminders here. Our next event is taking place on Monday, March 16th. It is a short LN Live on drag pedagogy for consent education. And next slide, please. We also welcome you to join us for the next Learning Network and Knowledge Hub webinar taking place on March 23rd, titled Exploring Neurodivergence, Disability, and Gender-Based Violence Towards More Affirming and Accessible Practices. Thank you once again, everyone, for taking the time to be here, for your questions that you submitted, and we hope to see you soon. Bye for now.